Hello, this is Dr. Lesliam, Quirós-Alcalá, and this module is on essential, undervalued, and overexposed, unique vulnerabilities among frontline and essential workers in the healthcare workforce in a pandemic era. First, we will start with some general demographics to learn more about essential workers in the healthcare workforce. So globally, the World Health Organization estimates that there are about 136 million workers in the health and social sector who face a range of occupational health risks. These may include, but are not limited to, biological, physical, and chemical hazards, as well as workplace stressors that are linked with mental health and workplace organizations such as shift work. Women are estimated to make up the larger portion of this global workforce, accounting for about 70% of the workers in the health and social sector. Now, in the United States, according to 2019 data from the U.S. Census Bureau, it is estimated that there are close to 10 million workers employed as technicians and practitioners in the healthcare industry. This includes physicians and registered nurses, with about 2/3 of these workers self-reporting as non-Hispanic white. It is also estimated that there are about 5.3 million workers employed in other jobs in the healthcare workforce, including nursing assistants, home health and personal care aides, and in other healthcare support occupations. And about 1/4 of these healthcare support workers self-identify as Black. Women also accounted for about 3/4 of full-time year-round healthcare workers. However, these statistics do not account for other essential workers in the healthcare workforce who also encounter workplace hazards and may experience similar or higher risks and are also considered essential workers. But first, let's define who are the essential healthcare workers. So according to the U.S. Centers for Disease Control and Prevention, or CDC, essential healthcare workers are defined as all paid and unpaid workers serving in healthcare settings who have the potential for direct or indirect exposure to patients or infectious materials. This includes those that are not directly involved in patient care, but potentially exposed to infectious agents while working in a healthcare setting. And these are workers who must physically show up at work, as remote or telework is not an option for these workers. So essential workers in the healthcare industry include not only doctors and nurses, who only account for about 20% of this workforce, but also healthcare support workers, which include lab technicians and medical assistants, in addition to direct care workers, which include home health aid workers, as well as nurse aides and nursing assistants. And it also includes healthcare service workers, which include hospital and facility housekeepers, as well as those working in food services. Notably, this is a group who often gets neglected or overlooked when it comes to worker health and safety. So because women are overrepresented in all of the essential work categories, this places them at an increased risk of occupational hazards compared to their male counterparts. They are especially overrepresented in positions that earn low wages, with over 80% of women being employed in healthcare support, direct care, and in the service sector. They are also often given lower priority for personal protective equipment, or PPE, than clinical staff, even though they may face similar health risks on the job. In addition, there are disproportionately women of color, similar to other low-wage jobs where women and people of color are concentrated. Now, disparities in wages are very much prevalent. Median wages in healthcare support, direct and service care jobs where women and people of color make up the majority are short of a living wage. It is estimated that there are over 6.5 million underpaid essential workers in the United States healthcare industry who are more likely to be in low-wage positions and experience heightened physical, mental, and financial hardships. These are also workers who often lack paid sick or personal leave. In addition, it is also estimated that about 20% of those in the workforce live in poverty, and more than 40% of them rely on some form of public assistance to make ends meet. Low-income status is also synonymous with other factors that can impact health, and which I will mention briefly in a few moments. In this graph, we can see that some essential, frontline, and high-risk due to COVID workers had the highest level of food insecurity reported. According to data from 2021 from the U.S. Census Bureau, those working in nursing and residential healthcare facilities were more likely to report sometimes or often not having enough to eat, compared to the national average for workers in other professions. This is also a workforce population that is expected to grow in the coming years. The direct care workforce, which is already sizable, is expanding rapidly as our population grows older, as people live longer with disabilities and chronic conditions, and as the supply of potential family caregivers also dwindles. This workforce has already nearly doubled within a decade. from 2.9 million workers in 2008 to almost 4.5 million in 2018. Now, looking ahead, the long-term care sector is expected to add a further 1.3 million direct care jobs, primarily personal care aide positions. And from 2018 to 2028, it is forecasted that there will be more new jobs in this sector than in any other occupation in the U.S. economy. This paradox between the changing profile of direct care and the persistent marginalization of direct care workers cannot be sustained in the face of growing demand. Now, during the COVID-19 pandemic, essential and frontline workers in the healthcare industry experienced many hardships and heightened exposures to workplace hazards, including biological hazards, given the potential for virus transmission, as well as psychosocial or mental health stressors, in addition to increased exposures to chemical hazards and, in particular, disinfectants.